The importance of reading your medical record, empowering patients in their healthcare journey. In today's healthcare landscape, patients are increasingly encouraged to take an active role in their medical care. One crucial step in achieving this goal is reading and understanding your medical record. Your medical record is a comprehensive document that contains information about your health history, diagnoses, treatments, and test results. By reading your medical record, you can gain a better understanding of your health, make informed decisions about your care, and even improve the quality of care you receive.
Benefits of reading your medical record. 1. Improved understanding of your health. Reading your medical record can help you understand your health conditions, diagnoses, and treatments. This knowledge can empower you to take a more active role in managing your health.
2. Informed decision-making. By understanding your medical record, you can make informed decisions about your care, including treatment options, medications, and lifestyle changes. 3. Error detection and correction. Reviewing your medical record can help you identify errors or inaccuracies, which can be corrected to ensure that your care is based on accurate information. 4. Enhanced patient-provider communication. Reading your medical record can facilitate more effective communication with your healthcare providers, enabling you to ask informed questions and seek clarification on any concerns. 5. Increased patient engagement. By taking an active role in reviewing your medical record, you can become more engaged in your healthcare, which can lead to better health outcomes. What to look for in your medical record. When reading your medical record, look for the following information. 1. Medical history. Review your medical history, including previous diagnoses, treatments, and surgeries. 2. Medications. Check your medication list to ensure it is accurate and up to date. 3. Test results *. Review your test results, including lab tests, imaging studies, and other diagnostic procedures. 4. Treatment plans. Understand your treatment plans, including medications, therapies, and lifestyle recommendations. 5. Progress notes. Read progress notes from your healthcare providers to stay informed about your care.
How to access your medical record. Accessing your medical record is easier than ever, thanks to electronic health records, EHRs, and patient portals. Here are some ways to access your medical record.
1. Patient portal. Many healthcare providers offer patient portals, which allow you to access your medical record online. 2. Request a copy. You can request a copy of your medical record from your healthcare provider or health system.
3. Electronic health record. If your healthcare provider uses an EHR system, you may be able to access your medical record electronically.
Tips for reading your medical record. 1. Take notes. Take notes as you review your medical record to help you remember important information. 2. Ask questions. If you have questions or concerns about your medical record, don't hesitate to ask your healthcare provider. 3. Review regularly. Regularly review your medical record to stay informed about your health and care. 4. Share with others. Consider sharing your medical record with family members or caregivers to ensure they are informed about your care. Conclusion. Reading your medical record is an essential step in taking an active role in your health care. By understanding your medical record, you can make informed decisions about your care, detect errors, and improve your overall health outcomes. Don't hesitate to access your medical record and take control of